Sorry for the delay. Jamie McCart will now talk to us about FMLA.
Hi, thank you, Jason, for having me. Thank you, Doug, for having me here today. Happy to be here. I'm happy we have such a large group. And as Jason mentioned, this is a lot of information to go through. I'll do it as quickly as I can, and that way those of you who have only allotted 45 minutes can get back to your next meetings, and then I'll stay afterwards, and I'm happy to answer any questions you guys might have. FMLA, Family Medical Leave Act. One of the big things since I've been working in HR, which is, well, 18 years now, is always balancing the needs of our employees and our employers, making sure our business runs, making sure the business needs are kept while making sure our employees are taken care of as well. And this is a big one, FMLA. The goal today is to talk about what do our employees need and what are we required as an employer to make sure they receive, and what do we expect from our employees, and how do we manage this leave, which is a pretty big amount of leave and a pretty difficult thing to work through every once in a while. As we're going through FMLA today, I want to hit on some major points. I want to define FMLA and really dig into some of the terms that are used during FMLA, because those sometimes throw off more than anything our understanding of what's supposed to happen. I also want to talk about what are our responsibilities as an employer, and what are the responsibilities of our employees, and how do we manage responsibilities from both ends. I want to stress and help you work on creating a plan and a policy in your workplace, because when we get down to administering this Leave Act in your entity, it's going to be very important that you have defined how you're going to make things happen, because you have many choices as you go. I'm going to go through some of the basic forms and where to find them. And again, I'm here and available afterwards and during the presentation for any questions that you may have. So let's just dig right in here. What is FMLA? FMLA is the Family and Medical Leave Act that is overseen by the U.S. Department of Labor. It applies to all public entities and businesses. So for most of us, that includes us straight away. For businesses, it's 50 or more employees. There are some special parts to FMLA that apply to rural school districts and airlines, but I'm going to stick to all the basics here and can answer questions at the end about some off parts of it. And what does FMLA do? It grants an employee up to 12 weeks per 12-month period to have unpaid job-protected leave for some very specific reasons: for the birth or adoption of a child, for a serious health condition of themselves, or a serious health condition of an immediate family member. So this employee, to meet the requirements to be eligible for FMLA, must have been employed at least 12 months for you in your workplace and have worked at least 1,250 hours. That is an average. I believe it works out to about 24 hours a week or more on average. So group health benefits must be maintained while the employee is on leave. We'll talk about that more, and I'll really dig into that for you and help you understand what that means from the employer's part and responsibility. And finally, just as kind of a side note, like a lot of things with our federal government, FMLA is not used for federal employees. There is a different FMLA, again, that you could do a whole presentation on, and that is overseen and administered by the Office of Personnel Management. So, again, digging down into some of these terms, let's talk about what does 12 months mean. 12 months means a couple of things, and you have a choice as an entity on how you're going to define 12 months. And that's one of the times where you are going to take the time to make your plan and make sure that you guys define which one of these you're going to use. The first one is easy, simple calendar year. You can go from January 1st to the end of the year. You can get any fixed months of 12 months time. So a lot of people might want to coincide that with their financial year, whether it be from July 1st to the end of June, or if they go to September 1st to the end of August. So those two are pretty fixed, pretty easy to understand. Your next choice is a 12-month period measured forward. So how you define that is if someone has asked for and been approved of FMLA leave on August 1st of a year, they can have that August 1st till the end of July of the next year, and that is their 12-month defined period of FMLA leave. So they can have 12 weeks within that 12-month period. And then finally, and this is what our entity uses, and this is what a lot of us use for some of our metrics in HR, like turnover especially, which is a rolling 12-month period measured backwards. So let me try to explain that a little bit and give you an example. If someone has applied for FMLA on April 1st of the year and meets the requirements and you approve their leave, then what we do in our entity is we go backwards from that April 1st 12-month period and say the person had FMLA leave the August of the prior year and took 4 weeks of leave in that August. Then I will take their 12 weeks and I will minus that 4 weeks that they have already used, and then they have 8 weeks to use going forward until that leave that they took in August falls off. And I can, again, oops, sorry about that. I can define that a little better. Let me go back when we get to it. And at the end, I can help you with that one. One more thing real quick before we go into this term is, let me see if I can get back to it for you guys. Oops, well, it keeps on, can I go back to the, more than, yeah, let's do that. Yeah, back. I missed a part on the, there we go.
Hey, Jamie, since we've got a little break here.
Do we have a question?
Yeah, we had a question just regarding public entities. The question was, are public entities under FMLA regardless of their size?
That is correct, and that's one of the questions that we get a lot, and how do I work through that when I'm a smaller entity? Again, we can really dig down, and one of the things I often ask people is, do they have a larger entity nearby that can help them? Do they have, I always beg and plead with people to put some liability accounts aside to make sure that they could have as an example, a temporary employee from a temporary area covering for an employee when they're gone, because I understand that especially when you're small, you can't go for a very long amount of time without someone in positions often. But yes, the answer is yes.
Great.
Okay. Sorry about that. Now back to the 12 work weeks definition. And this is important when you are asking people to use accrued leave for when they're leaving. This defines how much leave they're going to use during that work week. So a normal work week is defined by the employee's average work week hours over the 12 weeks prior to when that work or leave begins. So if your employee averages 30 hours a week and you're going to require them to use leave time, which is an option you have as an employer, then they would be required to use those 30 average hours a week as they're going through their leave. I wanted to throw this website up there, and I'm going to put it up a couple of times with some extra forward slashes for you, but this is where you can go to answer a lot of your questions. I know sometimes reading it on the website is hard, which is why we do seminars like this, but there's a lot of great information here, and you can get a lot of good answers right from looking it up yourself. And that DOL in departmentoflabor.gov FMLA, and you can search for it too when you get to the Department of Labor website. Okay, immediate family definition. We would think these kind of things are easy to define, but they're so fun to go through and really dig into what some of these things mean. So immediate family means a spouse, a child, or a parent. So right away people ask, oh, but my sibling, oh, but my grandmother. Well, the immediate family includes your spouse, your child, or your parent. So defining spouse, it's a legally married spouse. If you pop down to my third mark here, it used to get a lot more confusing, especially here in the state of Utah in the past 18 months or so, when we were asking about same-sex marriage. And is the same-sex marriage, is it accepted in the state? If they were married in another state, is it accepted in the state? The prior legislation said it's the same as common law spouse. If the state and where FMLA was requested to be taken acknowledges common law spouse, then it is applied in this case. Luckily for us, we've been through the court system, and now same-sex marriage is accepted in all states, and if the spouses are married, that is obviously included as a spouse. It does leave us still with the common law spouse, and a lot of times people will ask me, you know, I live with someone, I meet these requirements, we live in Utah, I looked this up on a website, and Utah is listed as one of the states where a common law spouse is acknowledged. It is acknowledged in the state of Utah if it is signed off by a judge or a magistrate. So I always tell them you have to meet all the requirements of a common law spouse, and if you do, then it is accepted as a spouse. But I think people misunderstand that in our state, you still have to get a judge or a magistrate to sign off on that. So that's something that you guys can share with your teams if they ask you about that. A child is defined as a son or a daughter. Now, this includes biological children, adopted children, stepchildren, foster children, and legal words under the age of 18. It also includes any of those above children if they're over the age of 18 and they meet the requirement that they are not able to self-care because of a mental or physical disability. I didn't include the page where it listed all the mental and physical disabilities that are included in that, but it is on the website. They've got a one-pager on it, and what I would do is, just like you would for anything else, require the person to bring you an affidavit by the doctor that states that the child over the age of 18 has one of these mental or physical disabilities, and then again, they would qualify even over the age of 18. This also will include someone who's standing in loco as a parent for any of the aforementioned people. I did have the situation, I can give you a really good example of this. What does that mean? I had a employee who, and this is kind of backwards, this person's parent would have been, she was the child in this instance. She was 14 years old and her parents passed away. She had a sibling who was her legal guardian who was 18 years old. Well, as we all know, it's kind of hard to raise yourself when you're 18. You certainly can't raise a sibling who's 14. She lived with family, and to this day does Christmas with them and Thanksgiving with them. Under every respect that she was their child, they were her parents. So that is a situation where legally the paperwork was never signed. This person wasn't adopted into the family, but they were her parents for all intensive purposes. There are often family things like that. You'll see grandparents raising children, aunts and uncles raising nieces and nephews, that kind of thing of their siblings. So be very responsive, and I would beg of you to be very sensitive to those needs. It's very easy when it's a clear cut. This is my child. I have to take care of him. He's terribly ill. Just be sensitive to the parent who comes to you and says, this is my child. It's not my legal child, but has lived with me my whole life, and by, again, all intensive purposes, is my child, could get legal custody of the child if they went to that. That is an acceptable FMLA parent or child. So the parents is almost the same thing, but the very opposite. This includes any biological, adopted, step, and foster parents of the employee. And it also, again, includes any parent that stood in loco to that employee when the employee was a child. One of the major things that I do get that is a little disappointing to people is it does not include parent-in-laws. So your spouse's parents, in this case, you don't get protected leave for leaving to take care of them. Your spouse would have to go do that. That's probably one of the major areas where I've had to turn down FMLA leave. Now let's go through what are your responsibilities as the employer, and then what are the responsibilities of your employees. Our responsibilities of an employer we need to post a notice regarding the rights and responsibilities under FMLA. I'm going to show you that sheet of paper. I think this is an easy one. Most of you guys have it. You print it, laminate it, post it. You can get it off the website. Used to be able to get it in some of the major office stores, ordering it online. There's lots of places you can get this poster, and again, I'll show it to you in a little bit. Information on FMLA must be found in an employee handbook and or provided in orientation. So for our entity, we have it in our policy manual. We have created a plan and created a policy. We go through our policy manual when we do orientation, and we also have the information available in our office constantly. When an employee requests FMLA, we must provide eligible information, so how to become eligible for it, and the information on rights and responsibilities to that employee. When we get to administering FMLA in your workplace, I'm going to go over how we get that done in our entity and some other ideas, but I highly recommend putting together a packet and having it ready to go with everything ready to go in it. You can just hand the packet to your employee, explain it to them, and you've got all this covered. And also you need to notify the employee what leave is considered FMLA and how much remains, as in you've got to record keep and help them understand how you're record keeping. So up until last year, we used to send out emails as people were on FMLA, reminding them how much they had left and where they are with their FMLA. That worked, but not everybody checked their email, especially when they were off and on leave. So one of the things we changed is we now put it on our paycheck stubs. So it's very clear how much FMLA they have used, and then we help them know how much is left as they go. These two points I'm gonna go over separately right now. And one is maintaining group health care benefits, because there are some choices you're going to make as an entity on how you're going to get that done. And also I want to talk about returning the employee to the same or similar job at the same or similar rate in a little bit better detail, but those are your responsibilities as well. So here are your choices when you're continuing health care for your employee as they're on leave. First of all, you must provide the employee with the opportunity to continue the group health care coverage at whatever coverage they had and whatever rate they had prior to the FMLA leave. You may continue to collect funds to cover the employee at the time and rate of the FMLA leave. So as an example, if you are requiring or allowing your employee to use leave time on a paycheck to cover when they're gone, the big opportunity here, and I highly recommend it, is to make sure that you're collecting that health care coverage premium as you're paying them as they are on the leave. So you write that in your policy so that it's very clear to your employee that's what you're going to do. Just like if they were working there, you're going to take it straight out of their paycheck. Then what do you do? First of all, if the employee has no leave or if they run out of leave, you've got two choices. You can collect it as they go and requiring them to pay it either every other week or once a month to your office. And if you do that and they don't pay it, you may drop the coverage of the employee if they're 30 days or more late in making the payment. Or if you have a policy on that, you would have to follow the policy as long as your policy is allowing for that 30 days. Before you do that, you must also give notice to your employee 15 days before you are going to drop the coverage and give them time to make that payment. The other option is you cover it as the employer, and this is what we do at our place of work. We cover that premium payment until the employee's back at work and collecting their paycheck, and then we create a contract with them where we subtract that from future paychecks. And it seems to work really well. And of course, if you do it that way, you are allowed at the end, at the point in time the employee doesn't return to work, you can collect the full amount of those of the premiums that they owe you from being gone on leave. So yes, you need to provide them the employee health coverage, and you can collect the premiums for that. Now, how do you get them back to work? The same or similar job, and what does that mean? It means that the employee is entitled to an equivalent position with equivalent benefits and pay, even if their position has been filled in their absence. So that's usually a big question. Can I fill their position when they're gone? I can't go that long without someone doing whatever it is that that employee did in particular. The answer is yes, yes you can. And then you have a few options. You can, when the employee is ready to return, you can move the employee. If you used a temporary agency or a temporary employee, you can say that's the end of the temporary position and return the employee to their original position, or you can create a position or put them in a position where they're doing an equivalent job with equivalent pay. Also remember that when the employee comes back, say a certification or a license has lapsed, it is your responsibility to give them time once they're back to recertify or renew their license. Now, the employees as well have many responsibilities. First of all, they must give you a 30-day notice of requested leave as possible. And right away, I always kind of giggle when I see that one because most of the time when we're talking about this kind of leave, we don't have that kind of notice. One of the few ones that we do have is pregnancy. We have plenty of time during a pregnancy to give a 30-day notice. However, unfortunately, there are a lot of events that come up that are immediate. There is no notice, let alone a 2-week notice, let alone a 4-week notice. So if the employee has a chance to give notice, they're required to do so. They're required to give you that notice as soon as they can. They also need to fill out all the appropriate paperwork requested by the employer. Again, if you've got someone giving notice, if you've got a scheduled surgery or your parents are scheduled or a child is scheduled to have something, then this is much easier. You give them the paperwork, they bring it in, you review it, you sit down with them, approve it or don't approve it and go through it with them. Why not? And I'll explain that later. If it is an emergency, again, that makes this a little more difficult. It's still required. They still have to do it. They'll just have to do it and turn it in after the fact. If required by the employer, they must utilize accrued paid leave while FMLA. Again, this is one of those things that I suggest you really consider during your plan and creating your policy. Again, at my entity, we do require that our employees utilize their leave while they're on FMLA leave so that, one, they are paid, and we do collect the health premiums, and two, for lack of a better word, it puts a bite to it. If we're going to let you go and not use leave and just leave and leave and leave, and you've got accrued time and you're not using it, it makes a difference on whether people want to come back or not and save a week or two for a vacation or annual leave or in case of other sick leave later. So I highly recommend that you use that. And then upon intermittent leave approval, they must be respectful of the business and make reasonable attempts to plan for appropriate scheduling of the business. This is probably, I'd say, one of the biggest places where we need to bridge the gap between the employer and the employee and make sure that the employee understands that while this leave is approved and we're going to support you, it's got to balance with the needs of our business, as in no calling 5 minutes before your shift and saying, I'm on an FMLA leave, I can't come in today. You're going to make a plan in your policy and you're going to have them follow some kind of intermittent leave approval schedule, meaning you're going to turn it in a week or two before, you're going to make them call in a certain amount of time if it's an unexpected leave. And yes, you can discipline someone on FMLA leave for not following whatever plan and policy you have put in place. Also, if it is requested by the employer, and again, I encourage you to put this in as part of your plan or policy, certification and support for that leave. You are entitled as an employer to be able to know when that person's going to be gone, how often, if it's intermittently, if there's an idea that medical personnel can give you a time frame for that as well, or how often during the week or how often during a schedule a person needs to be out. You can request that and should have the employee provide that to you. Also, you can request and should periodic status reports to the employer. We have administration in our offices through our HR office, so that helps us. We follow the HIPAA laws, and we know them well, and we understand how to keep employees' information private, and we contact the doctors. We have them sign off that we are allowed in periodic reviews, and have the doctors write for us when those should be, to call and check on the leave ourselves. If it's requested by an employer, and again, I like to have this, provide a fitness of duty certification when the employee returns to work. That is a work release. And this is really going to help you when it comes down to, I have an employee coming back, they're bored, they don't want to use any more of their leave, but are they really fit to return to work? The last thing you want them to do is come to work, have an accident because they're not well to be back at work, and now we've got a workers' comp issue, possibly an ADA issue, as well as your FMLA leave. So there's a lot of things that can go on here. We really want to make sure the employee is ready to be back. So you can see how important it is to create a plan and write a policy back at your workplace. I highly recommend getting a group together. When we put these things together, we use our HR office, people that are trained, and go to webinars like this, follow certifications on HR. I use my legal team. Sometimes that helps me, and they may have seen things coming up that I haven't seen yet, to interpret these rules and how to write them. And most importantly, remember when you are putting together a policy and a plan, this is for the protection of you and your employee. You don't want your employee feeling like they're not able to utilize the leave that they are given, that they are, we are required by law to make sure that they are protected with, and then you don't want to make sure that at work the business needs are not being met. So you've got to really define these terms, make sure you guys have worked through different situations and how you would like to deal with them. And I'm going to go through some specific ones that maybe you should address as a group. And again, having a group of people together doing this so that you're hearing other versions of what happens in my workplace when this doesn't happen, and what happens in my workplace when that doesn't happen, so that you can come up with a good plan. I like to also remind everybody, this is something where if you have a policy, that's great. You've got to practice it. You've got to practice it the same with everybody. It's got to be fair and consistent, and that's only fair to you, and it's only fair to your employees. So we use the hot oven rule. That's just a way to remind ourselves that everything's the same every time, and sometimes we have to stop and say, okay, this person asked for this. Have we done that before? Is that something that is approved according to the policy we wrote? Doesn't do us much good to have this wonderful policy if we're not going to follow it the same every time. So what does the hot oven rule mean? It means every time you touch a hot oven, you're going to get burned. It doesn't matter who you are. Everyone gets burned, and it doesn't matter if you touch it today and then come back and touch it tomorrow. Both days you got burned on that hot oven. All that means is every single time you are as same and consistent as you possibly can be. So having said all of that, let's talk about what you guys as a team should get together and write in your policy. And by the way, if you have one, I'd go back and review it. Make sure you're up to date. Make sure, again, any of the rules or regulations that have changed since you last wrote your policy, or if anything has come up in your workplace and you'd like to add that as part of your policy because you find it didn't work, to go back and review it and change it. If you go to twila.org, you can pull up on our website and go to personnel or human resources. You can pop down and you can read our policy on it. We have it online. It's open and available to everybody, and it can give you an idea if you haven't written one yet, you know, what it could say. It's pretty long because you're going to see we're going to go through a lot of things that should be on your policies as a guideline. Define the leave as we did here earlier. How is an employee eligible for this? How are the 12 weeks determined? How are hours measured? Define what a spouse, a child, and a parent are. Define what a serious health condition is. State what the basic leave is, just like we did here. I would add and state what military leave entails. Again, I could do a whole separate webinar on that because it's a little bit different from this basic FMLA, so you want to read through that as well. State how your entity is going to deal if both spouses are employed by the entity and have a child or the birth of a child coming up, because that happens quite frequently. Represent if you're going to require your employee to use the leave and how much of it they're going to be required to use. Represent how you're going to deal with paying benefits while the employee is on leave. Just as we were talking about earlier, you have some options with both of those things. And you want to define how and if you're going to work workers' compensation concurrently with FMLA and how you're going to manage that. You're going to explain how you're going to return your employee to their status when they come off of their leave. And very clearly, this is probably, again, I know it's very important. Intermittent leave is very difficult. It starts to get confusing, and sometimes it's hard to track. You want to make sure you define your time of breaks and how to track them. I have had people ask and be approved of FMLA where the FMLA leave that they requested was, I need to get up and walk around a certain amount of time during the day. So you need to define in your policy if someone needs to be up and around and they clock out to be on FMLA leave, how long you're going to require them to be out at a break of time. You also need to define what a reduced work week is and how you're going to schedule around it. And there are different reduced work weeks. It could be where the FMLA was approved to reduce their work week from a 40-hour work week to a 20-hour work week. Well, what does that mean? Does that mean 5 hours each day? Or does that mean I can come in on Thursdays and Fridays, but I can't come in on Mondays and Tuesdays and Wednesdays? And how you're going to deal with scheduling in the office depending upon which kind of reduced work week that's going to entail. Very importantly, how to deal with unexpected absences. Just like any employee at any time of the day or any time of the year, on leave or not on leave, there are going to be some unexpected absences come up that they're not going to be able to plan for. How are you as an entity going to respond to that? How are you going to give them time? Do you want them to call in? Do you need a day's notice? And how you're going to deal if they don't follow whatever your policy is. And then how to communicate. One thing in our entity we found is texting doesn't work well. So we require people to verbally communicate to their supervisor or to the HR office if they prefer, how they're going to manage the leave and how they're going to deal with unexpected absences. There's no texting involved. So then you're going to write your policy. What are your procedures for requesting FMLA, and what to do, again, we talked about this, if it's after the fact. Because a lot of times FMLA is going to be after the fact. Something's going to happen and your employers are going to come back to work or not even come back, but at the moment that happens, they didn't know they were going to need FMLA or need to use it. Remember, policies are used to inform and to clarify. They're going to be guidelines. They're guidelines to determine the proper and consistent form of action. Practice is what you actually do. It is what you determine the action's going to be based on those policies that you put in place. So make sure what you're practicing is in line with your policies, and if they aren't, then you might want to consider updating your policies. And it's very important that the relationship between an employer and an employee be clear and consistent. When we get to the question and answer part, we'll probably go a lot more into this, but it really saddens me when employers get really negative about FMLA leave. Your employees are there to support you and to make sure your business needs are met, to service your communities. If they are well taken care of, you will be well taken care of, and your citizens, your community, and your services will be well taken care of. I would beg of you to make sure this is a positive experience for you and the employee, and that allows everybody to do the best that they can be. If you have faith and belief in your employees, they're more likely going to be back at work and be productive in a shorter amount of time, and they're going to be missing being at work. Okay, this is just real quick. I'm going to go through these forms because you can find them all on the website, and I'm going to pop that website here up at the end. But here is the form we were talking about at the beginning. This is the one that needs to be published in a workplace. In view, I recommend putting it in an employee break room. Outside. We have a big hallway outside of our auditorium, and I have all of our regulations and forms up that I need to post. They're huge. They're on a great big wall. You can walk by it and see all the things that we're required to post as an entity for our employees all in one place. We also provide them on our website. These are the notices, and there's one more here. Don't worry about the numbers. You can find all of these on the FMLA website under the Department of Labor again, but I want to walk through them a little bit with you because these are the ones that you're going to have to get familiar with if you are administering this for your entity. So the first one is the WHD 380. That's the certification of the health provider for the employee, which is the E, or the family member, which is the F, serious health condition. This is the one where you're going to have contact with the medical professionals. They're going to leave you advice about how long this person's going to be out, when they're going to be out, what they're going to be out for, if they're coming back, if there's going to be restrictions on their return to work, things like that. 381 is the notice of eligibility and rights and responsibilities. That's required for you to give out to your employee. Again, when we get into administration, I'm going to just tell you over and over again, have this all ready to go in a packet, ready to go with everything you need and everything the employee needs in one place. And those are just reviewing what we just talked about here, rights and responsibilities. The 382 is the designation notice. That is your answer to the employee. And if you pull that one up, if you haven't been through these, I would pull them up, print them out, and get familiar with them today. The designation notice is your answer to the employee. I approve your FMLA leave. Here you go. This is the parameters around what it's approved for, which, I always use whatever the medical professional asks me to. And then if I don't approve your FMLA leave, it gives me a space to write why. I sit down with the employee and review why. And on this notice, it has an option for them to have rights to appeal, and they can read that and how to go about that. And there are just different forms here for the military FMLA leave. Here is the, let me get it up here for you, website to find these forms. So again, you can go right on to the Department of Labor website, search FMLA. If you write down this link right here, you could go straight to it. It will pop up at the bottom of, or the middle of the page down, all these forms. You can print them off, read through them, and get familiar with them. All right, here is where the rubber meets the road. How do I make all of this happen back in my workplace and have everything flow smooth and make sure everybody's taken care of? I can't stress any more than I already have. Create a packet ready to go, have it available. We have it available online. They don't even need to walk into our office, but I, of course, always encourage them to come in and let me help them work through all the paperwork. This will include all the information your employee needs in one place. I have added some extra forms than the legally required forms at our entity, and I'm going to tell you these and encourage you to do something like this for you guys as well. My cover sheet explains what they're doing and what the packet contains in it, so that make sure they have all the information and papers in there. I have a checklist and a signature area for the supervisor and the employee. The one thing I encourage here is that you make sure the employee has let the supervisor know that they are going to request the leave. They don't have to tell the supervisor much of anything else, but that they are asking for the leave and when that might be. There's a lot.
Yeah, it's Jason.
Oh.
It's what?
Feedback
we're
coming back in my feedback here.
I'm
thanks.
trying.
Oh, there, that's better. Thank you. You can also have an intend to return to work page. I think this is very important. It doesn't obligate the employee to return to work. Sometimes that does not happen, and things change as need to progress for the employee, but at least you have an idea if the employee's intention is to return to work at that point in time. That will help you know whether you want to replace the position permanently or if you want to have a temporary person in that position until the employee decides whether or not they want to come back. Again, the certificate, or the forms on the website 381 and 380 should be in that packet. I include our policy in that packet, so it's very clear the things that we were talking about, that we do require you to use your leave. We do require that I am able to follow up with your medical care provider and ask for progress checks so that it's open to the employee what I am going to do as the employer. I also include the GINA information in there. That's the Genetic Information Act that tells them that if I'm, again, just like all HIPAA laws, if I'm looking through or talking to a medical provider and they tell me something about their genetic information, I will not hold that against them. I also give them, and this is a great one for you guys as well, the Department of Labor fact sheet number 28. That is found on the same website link as the forms are. And that just goes over the basics of FMLA like we're doing here today. I give that to them. I encourage you guys to look at it. It's a great form to go through the basic facts. And also, of course, the last sheet of my page is my designation notice. So that's my answer to them and why I chose that answer of if they're approved or if they're not approved. If you have the opportunity, post this information online because sometimes, like I said, there might be an emergency come up and the person, something happens that requires them to be on FMLA leave and they're at home or even in the hospital. If their family can pull that up online and get that filled out, you're going to receive that quicker and you're going to be able to start your follow-up and making sure that everything's in place for that employee versus that waiting until they can get back in the car and drive to where they are and come into your office. So if you have the opportunity to provide that packet for them or any information for them online, I would encourage you to do that. Also inform them during orientation what your procedures are for this. And then not just the employees, guys. You need to train your new supervisors how FMLA works. The last thing you want is for an employee to go to one of their supervisors asking about an FMLA that would have been an approved FMLA, and the supervisor goes, nope, I just can't have you gone that long, so no. That's not going to be good for any of us. And also review it with your current supervisors. Rules change, regulations change, and if they're not doing it every day on a daily basis like we are in an HR office, then they're not going to remember everything and know how to answer questions unless you help them and you review with them. Also, there are a lot of times the employee is very close to the supervisor, and in that case, use that supervisor to help aid you in following up with that employee, making sure they understand how much leave is left, making sure they understand what their rights and responsibilities are and what you require as an entity, especially when it comes to returning to work. And work close with payroll to evaluate the time used and remaining time available. If at all possible, as I encouraged before, we have gone to putting our FMLA leave right on a time card. It's transparent that way. Of course, this was very easy for us because we also run payroll administration out of our HR office. But if you don't, go with or go to whoever does administer your payroll and see if that's an option for you guys as well. If not, again, you want to use your email techniques to make sure that you have a way to keep a track and keep communication with the employee who's on leave and the supervisor. So, if you guys have any questions, I'm available now to stay and answer them. I also put up my my email here. I'm happy to answer questions not only now or today or as they come up. Just send me an email and I'll do the best I can getting those answered to you. And I'm happy to answer some questions that have come in now.
Okay, the first question we have, when using a 12-month rolling backward calendar, do you have to use exact days or can you round monthly? And if you can round, how would you round? For example, April 20th was the day the leave was taken. Would I go back to April 1st or forward to May 1st?
Okay, good question. And you could do it either way. Again, it needs to be defined though. You can't do it one way with one employee and another way with another employee. So if you define it as a month's time so that you're not going by the middle of a month date or hours in the middle of the month, then you define it in your policy as we will start the leave count at the beginning of the month in the month that you began the leave. Or you can just go straight to the actual date itself. So that's, again, something you're going to have to decide on and write it in your policy and be very clear.
The next question. I'm muted. Can you?
Yes, you're muted, Doug. Sorry.
Yeah.
I got the audio back.
That's a good question. They can, actually. They can. You can be disqualified on or qualified under FMLA to work a specific job, yet, or you might not be able to work one job, but you could work a different job, and that is true, and it can happen. And yes, the answer is yes.
Requiring an employee to use all their accrued pay leave, sick vacation, etc., does that also include required use of comp time that they've earned from working overtime?
Yeah, again, that's defined in your policy, and mostly you have to be consistent. If you're requiring everyone to use it and your practice is that, then yes, you would be, yes, you can require, yes.
Jamie, we can't hear Doug.
Okay.
So if you would maybe just kind of.
Oh, yeah, I think I can read the question, or I can tell you what it was. The question was, if they have comp time as well as sick time or annual leave time, can you require them to use that for FMLA? And the answer is, again, yes. We required our entity actually that you use your comp time first. So we actually have an order of leave usage, and one of them is you have to utilize your comp time before any of your other time, and that applies for FMLA as well as any other particular type of leave. Okay, next question. If employer does not return to work, can you recover the employer portion of the medical insurance premiums from the employee or just the employee's portion? Just the employee's portion. You can only recover the premiums that you would have normally charged the employee. That is a good question, yeah.
If they come back but immediately leave employment with just a short period of time?
What if they come back 2 weeks or so and voluntarily quit? Can we recover the employee? No, you cannot recover the employer's portion. You can always recover the employee's portion.
Okay, if someone doesn't request FMLA leave, but they have requested time off for a reason that falls under FMLA, can we require that they use FMLA leave?
Yes, you can, and I do that. It's a very confusing. A lot of people who haven't done that don't understand that. So we'll have smaller surgeries where someone will be out with a knee surgery and out 2 or 3 or 4 weeks. And then they just say, I have a doctor's note that says I'm gone, and they haven't done any of their FMLA leave. I require them to come get the forms, or I'll email them to them, and I make them fill them out and bring them back into me. And then, yes, those are counted as FMLA leave hours.
How about with work comp?
Yeah, good question. In our organization, we require those to be used consecutively. So the law is, if you use them consecutively, you have to give the employee the higher benefit of the two. So I can make them use their FMLA leave. Sorry, that's feeding back again. I can make them use their FMLA leave while they are collecting their workers' comp, and in conjunction with taking their workers' comp, I do require them to also utilize any leave that is different from the total amount of pay they would have gotten or time they would have used out of their paid leave to give them a full and complete paid check, and I do also make them utilize their FMLA leave.
So just along with that, Jamie, the question, I think a little more into the question, if they're out of work for longer than 12 weeks allowed by FMLA, is their time off no longer designated as FMLA, or can you start another rolling 12-month period at that point?
If they're out of week for longer than 12 weeks. Well, you would only start another FMLA if they've hit that next 12-month period. You wouldn't start another one right away until that 12-month period is over. Is that the question?
Yeah, it was just so once they've exceeded their 12 weeks, it's no longer FMLA time. It's
workers' comp straight only time. Yes, correct.
Okay. Doug, are you? I'm not hearing Doug, so I'm not.
My audio isn't working.
Oh, can you send us your cover sheet checklist? Yes, I can. Jason, I can get that to you. Maybe you can blast an email out. In fact, you guys could go on our Tooele County website right now. Go into the Human Resource Department page. Go down. I think it's about on the left-hand side of the page, about halfway through, and FMLA packet, and hit it, and you've got the whole packet right there. Everything I put in it right there.
Awesome.
Okay. Hypothetically, the employee is out on workers' comp on July 1st for a total of 3 years, 12 weeks for each of those. Oops, 3 is designated. That's correct. Yes, that is correct. So she's asking, Brittany's asking if the employee is out for 3 years on workers' comp on July 1st. 12 weeks for each of those years is designated as FMLA time. So I guess when they come back at that point in time, depending upon where you are in that 12-month period of FMLA, they would either have some more leave or not and have to use it. And then, of course, at that point, they're probably out of paid leave where you are. So they'd have to start reaccumulating that and then, of course, wait the next 12 months for their next FMLA, yes. I'm guessing that was the question.
It looks like all the questions we have so far.
Did you catch the one on the 12-month rolling calendar? Sorry, I was incommunicado.
The first one, yeah, that was the first one we did.
You did catch that one? Okay.
Yeah.
And then there was, let's see, a question on or a comment on the employee test for public entities. Let's see. Part of that test is that the employee must work at a work site where there are 50 or more employees within 75 miles of the work site.
Yeah, that's called the rural designation, yeah. So if you are somewhere and you aren't, if you are so far away from something else, then FMLA does not apply. There are other parts of FMLA that you have to work through with that. So that's a whole, it's called the rural designation. That's what I was saying. Jason, I can come back and go through some of these super specific and, yeah, like school districts, airline pilots, medical, military leave are all a little bit different from this basic FMLA.
And then some of the specifics as far as managing workers' compensation cases and how these cross over, and ADA as well. And
ADA as well, and bringing back people and making sure that, you know, a great question that didn't come up is what if the person can come back to work but they can't do their job that they once did? Am I required again to pay them the same? So we could talk about all of those things that, you know, do another webinar and go through some very, very specific questions.
Yeah, as a matter of fact, we've got that one on the schedule to have
okay.
you come back and fill us in on the rest of this stuff. So awesome. Doug, do we have anything else come in?
Well, I don't know if you can hear me still.
I can hear you.
I think there are a couple more questions that just came in.
Let's see. Can an employee
be out on FMLA for multiple reasons? Surgery and pneumonia, but only have a total of 12 weeks FMLA?
Only unapproved 12 weeks per 12-month period, and yes, they can be concurrent with one thing or another. Some things can come up twice.
And, where did it go? If they run out of FMLA leave, what is the organization's business options if they can't return to work?
That's a great question. Again, consistency and fairness is of the utmost importance here. I actually just had a situation like that, and so I'll walk you through what I did, and this was a tough one. I had a lady out on FMLA leave, and she had terrible, terrible back pain. While they were trying to figure it out, she was using up so much of her leave. About 2 weeks before her leave was over, they scheduled her for surgery, and I talked with her doctor, and I talked with her, and we sat down together, and he said, I can have her back to work, but she's going to be 2 weeks out past prior that 12 weeks that you've allotted her. But I can guarantee you when she comes back, I'll have her to work this amount of time, and within 4 weeks after the surgery, I'll have her back to work then. So what I did was I wrote up an agreement with her that I would allow her, again, to have unpaid, because she was out of time by then, unpaid yet protected leave until that doctor's notice was up. But she had to follow it completely as we wrote the agreement up. And sure enough, she was back to work part-time 2 weeks after. So 14 weeks, she was back to work part-time for 2 weeks. And at 16 weeks, she was back to work full-time. She's with me today. She's very happy. She's so thankful we gave her that extra time. Again, this is that balance, guys. You're the employer. Do you have to do things like that? No, you don't. At that point, you have no legal obligation to keep your employee there. I had a great employee. Her customers loved her. The community loved her. It would not have been to my advantage not to work with her when I knew that we had an end date. Now, if we didn't get her back or if she didn't follow the agreement at that point in time, again, I had every legal responsibility to let her go at that point. But she did exactly like we asked, and we brought her on or brought her back.
Jason, you mentioned another FMLA webinar. When's that scheduled for? I don't think Jason can hear me. Looks like Jason's having a little bit of trouble. I think your microphone's the only one that's working right now.
Okay, so we will announce to you as soon as we know when the next FMLA Part 2, we'll call it Part 2, what to do when FMLA leaves, how to get employees back to work, some of the specific questions that don't follow this basic plan like we were talking about earlier, military leave, rural communities, airlines, things like that that don't fall under this basic leave plan.
So given the technical difficulties, I think we'll go ahead and end the webinar now. And so just thank everybody for tuning in.
Thanks everybody for coming. Again, feel free to email me. I'm happy to answer any more questions or let you know when our next webinar is. It's going to give you some more one-offs and more specifics. Thanks, everyone. Say bye, Jason.
I'll say goodbye. Sorry, folks, I lost my audio. We will be recorded the webinar. We'll place that up on our website. We'll also be scheduling the next webinar where we talk about this. If you're not getting our announcements, please send me an email to jason@utahtrust.gov, and we'll get you on the distribution list so you don't miss the announcement for that. Once again, thanks for attending, and we'll talk to you again soon.
I can't. Right. Yours worked great, though.
Actually, yours